Hello everybody, hi, I'm Jewel and welcome to my channel. Today's topic is KKF study reveals challenges in co-management of kidney patients in primary care. I think most kidney patients understand this very well. Communication with nephrologists is key. The Journal of General Internal Medicine published a new National Kidney Foundation study describing key challenges in primary care practitioners and nephrologists working together to care for patients with chronic kidney disease. The investigators found that primary care providers had difficulty developing working partnerships with nephrologists because they were not timely informed, exchanged about their shared patients. Their roles and responsibilities were unclear, and primary care providers had limited access to nephrologists for advice. Effective co-management of CKD between PCPs and nephrologists is essential for the delivery of efficient and high-quality CKD care, says Rachel Greer, MD, MHS, the lead investigator. However, PCPs experience significant challenges in the optimum co-management of their patients with CKD. The authors reported that currently co-management of patients with CKD remains suboptimal. The National Kidney Foundation is proud of this small but important study that demonstrates communication and care coordination barriers between PCPs and nephrologists. The investigators offered electronic consultation to facilitate easy access to nephrologist advice, care coordination agreements to clearly define roles and responsibilities, CKD payment reform to incentivize care coordination by clinicians, and other tools to facilitate timely exchange of clinical information, particularly when the primary and specialty clinicians operate on different electronic health record systems. The investigators concluded that better communication tools and CKD care plans are needed to improve PCP nephrology collaboration. All right, guys, the reason why I chose this is because I understand it very well, and I think most kidney patients do too. If you are a kidney patient with CKD and you are basically your own advocate and you're doing very, very well, it's easy to get your primary care doctor and your nephrologist to collaborate, because you are able to facilitate that yourself by asking your doctor to send all your records to your nephrologist and have your nephrologist consult with your primary care doctor. So it's easier in that sense. But if you are not as well and can't be your own advocate, it makes it a little more difficult. And to the primary care physicians, I think, in my humble opinion, that a lot of them are just overwhelmed. They have so many patients, so little time to spend with their patients. So it's really easy to see and understand that, a CKD patient takes a little more time and effort. And when you are overwhelmed with patients, that's very, very difficult. So I'm so glad that they are aware of this problem, with CKD patients, and hopefully they can find a solution for the primary care physicians so they can do a better job with their CKD patients. Not that they, are not trying to, but there's so many, I think there's so many barriers. Like I said, they're overwhelmed with patients. There's so much information, paperwork. It's a little overwhelming. So I'm hoping that they can coordinate something with all practitioners to, with nephrologists, so they can do a better standard of care for CKD patients. So everyone, this is National Kidney Foundation study reveals challenges in co-management of kidney patients in primary care. And if you found any of this information useful, Please like, share, subscribe. And as always, we are sending you love, care, and as you see, there are so many people working in the background to make our health, optimal, the best that they can be. So, as you know, guys, I always say one thing, just be compliant with your doctors because, of course, that's always going to take you forward, and always, always stay positive. That is for all of us in every area of our lives. So, guys, take care of yourselves, and I will see you on the next video. Bye.